My name is Ashley Winter. I am a board-certified urologist who specializes in sexual medicine, and I'm based in Los Angeles, California. So this is a great question. I think a lot of people traditionally think that arousal and libido are kind of the same thing. Libido is more what we call desire, so interest or desire in sexual activity. And arousal is actually the changes in your body that happen in response to a sexual stimulus, either a physical sexual stimulus or a mental sexual stimulus, thinking about something sexy. And that is typically what you're gonna see as engorgement of the genitals, lubrication of the vagina and the area opening around the vagina, and in men, arousal being an erection. So, yeah. The most direct relationship is between estrogen and arousal. So estrogen is responsible for maintaining a healthy amount of blood vessels in the vagina, the glands surrounding the vagina, and in the clitoris, and kind of the whole vulvar region. And so when you have a sexual stimulus that is exciting, if you don't have enough estrogen in those tissues, the blood vessels can't dilate and you cannot become lubricated, your tissues cannot become engorged. So that is a really direct relationship. So it's not that you need to have more estrogen, but you just need to have enough estrogen for that tissue to be healthy. Testosterone, we don't know as much about the direct relationship, but we do know that all the female genitals are very sensitive to testosterone, and there are receptors for testosterone throughout the vagina, the vulva, and the clitoral tissue, including the clitoral erectile tissue, which is very, very cool. And so we do know that some amount of testosterone is important for the healthy functioning of those tissues and for those tissues to become aroused, engorged, and lubricated in response to sexual activity. In terms of libido or desire, right? Again, we know that having a healthy hormonal environment is important for having sexual desire, for having libido. There is a more direct effect of what we call neurochemicals or neurotransmitters on the brain, which are not hormonal, on our desire levels. But there is a lot of research out there showing, for example, in women after menopause, particularly after a surgical menopause where their testosterone levels are very low, that actually giving them testosterone can help with their sexual desire and their libido. So. Over the course of your lifetime, on average, you go through puberty, your estrogen levels and your testosterone levels go up. Estrogen levels, I think most people know that women's estrogen levels go up in puberty. A real common sign of high testosterone levels in puberty, which is normal, is acne. So a lot of acne is actually androgen or testosterone mediated. And then you have essentially a pretty similar amount of hormone levels throughout your reproductive years. And then as you go into perimenopause, the menopause transition, and postmenopausal, on average, the estrogen levels go down and the testosterone levels are more stable, but they do go down to some extent. If, again, as I mentioned before, somebody undergoes a surgical menopause, which is removal of both ovaries, actually their testosterone levels can drop quite a bit lower. Some other things that can affect hormone levels would be things like hormonal contraceptives. So if you're on a high dose of a hormonal contraceptive, you may actually have higher levels of some of these hormones. If you're on very low level contraceptives, you can actually have lower levels of these hormones because your natural production is reduced. So it is important to know that at whatever phase of your life. It doesn't have to be just postmenopausal, for example. If you're on certain medications and you're experiencing distressing symptoms of low desire for sex or distressing symptoms of reduced arousal, that you should talk to your physician, and there might be a role for having those hormone levels checked.